Spinal stenosis. What is it? Why does it happen? And what can you do about it if you want to avoid surgery or long-term reliance on medications? So we're going to break that down today in a way that's easy to understand and, more importantly, gives you practical steps you can take right away. Welcome to Back Talk with Dr. Ryan. I'm your host, Dr. Ryan Wohlfert. On each of these episodes, I address the most common questions and misconceptions about back pain and spinal health, show you how you can strengthen your spine and be your own guarantee for your health in your life. And today we're diving into spinal stenosis. What is stenosis? Well, stenosis refers to a narrowing, and a spinal stenosis means a narrowing of the spaces in the spine where the nerves go or where the spinal cord is. So this narrowing, depending on where it is, can put pressure on the spinal cord or the nerves. It can cause symptoms like back pain or neck pain, again, depending on if it's in the back or the neck, cause numbness and tingling or even weakness. Now, you might also even get muscle cramps, muscle cramping, a heaviness feeling, especially with walking, balance issues, and in very severe cases, bowel and bladder problems. So you want to watch out with that. If it's severe, you definitely want to see a doctor right away if you're having any problems with this. And unfortunately, symptoms can worsen over time and often gradually. So one can build on the other. You might notice the pain, then it might get tingly, it might get numb, then weak. So you want to watch out if you're getting progressive symptoms. So how do you get spinal stenosis? So anything that causes the narrowing, all right, can cause the stenosis. So it could be herniated discs. It could be disc degeneration and arthritis, a thickening of the spinal ligaments, of the ligaments holding the spine together in those joints. So these bone spurs can also form from the degeneration, from this extra stress, excessive stress placed on the bone. That's where bone spurs come from, and again, can narrow these spinal canals. Arthritis, is a active form, I call it, of degeneration. So when it gets active and painful, swelling can happen. So these joint swelling can, again, also narrow the canal and irritate the nerves. So what can you do about it? What are some treatment options? Now, you might think, and you might have heard, okay, you need to get surgery. Surgery will fix the problem. And yes, in severe cases, if the nerve is really pinched from the bone, from that narrowing, the stenosis, it might be warranted. But other non-surgical options definitely exist. And one thing that you might have heard, or commercials, they're all about these drugs and taking medications. But again, if it's from a physical structural problem, right, then medications are only going to provide the symptomatic relief and not actually get to the actual cause of what is causing the stenosis and causing the pain. So first, let's start off with some exercises for spinal stenosis relief, spinal pain relief as it relates to stenosis. Again, this definitely is dependent on what is causing your stenosis, all right? So certain movements can create space within the spine, create more mobility of the spine, alleviating the symptoms. And so what I'm going to do is I'm going to link to a video that I did called 5 Simple Exercises for a Strong and Mobile Spine. And it, again, goes over these 5 exercises. I want you to pay special attention to the exercise called the seated cat-cow exercise in that video. Now, you also want to focus on exercises that strengthen the core, the midsection of your spine, the abs, and spine supporting muscles. And that will help reduce the load that you feel on those injured structures or on those structures of the spine that are affected in the nerves. So my favorite exercise for that is called an abdominal brace exercise. I'll link to that video here as well and also in the description. Now, there's also something called extension traction. Now, this extension traction gradually stretches the spine and the ligaments, and not necessarily stretches the ligaments, but remolds the ligaments into the healthier alignment, into the healthier structure that it needs to be in. And there's a bunch of research done by chiropractic biophysics, and it shows how improving the structure and the curves of the spine can help reduce the stress on the nerves and improve spinal stenosis symptoms. And it helps to, like I said, retrain over time these spinal structures in relieving the pressure. I'll link also to the studies that have been done, even these case studies, because it shows how when you do this, it can reduce your pain and improve function using this extension traction. And by creating more space, obviously it relieves the nerve pressure. So for example, a home unit called the Denerol, a lumbar Denerol if it's in the low back, cervical Denerol if it's in your neck. These are home units, but you have to be trained on how to use them by a qualified CBP provider like myself and under the supervision of that to make sure that you're using it correctly. So now the next thing to address is your lifestyle, like these lifestyle adjustments. So posturally, so we want to pay attention to the posture, especially if you're spending a lot of time sitting. Now, if you have spinal stenosis, especially in the low back, that's causing weakness, numbness, tingling, heaviness in the legs, especially if you're walking and it gets worse, you have to balance that out. Now, obviously, I don't want you standing up all the time and walking all the time, but we want to have a good balance between sitting and standing, because if you sit too much, that poor posture puts a lot of stress on your spine, especially your low back, and can, again, progress the reasons why you have the stenosis, especially the degeneration, the poor posture, making the narrowing worse. So you want to make sure that you get up at least every 30 minutes and move around. I would even say even 20 minutes, because 20 minutes is the amount of time to where the ligaments start reforming in the distorted position. So again, we use that principle to help even with the traction part of it, like we discussed, is doing specific forms of traction for 20 minutes at a time to help, again, retrain and remold the ligaments. And when you are sitting, you want to maintain a neutral spine. You don't want to be slumped down. You don't want to be hunched over, because that slumping forward puts a lot of stress on the nerves and on the bones and on the joints. Okay. Now, another part of these adjustments you need to make, even lifestyle, we'll give it a different category, is nutrition. Because if you're carrying extra weight, extra pounds, losing even a few pounds can take stress off of your spine. As little as, increase excessive weight of 1 pound adds 7 to 10 pounds of stress onto your discs and onto your vertebrae of your spine. Okay. So having a anti-inflammatory diet, eating anti-inflammatory foods. And what I'll do is if you want a food list, all right, I call it my Strong Spine, Be Your Own Guarantee food list. If you would like that, I can send that to you. Just type in list in the comments and I will get that Strong Spine, Be Your Own Guarantee food list to you. So you actually have a list of foods that are really good or great and ideal, all the way to zero foods where you want to avoid those as much as possible. You don't want those to be a staple of your diet if you want a strong spine. So remember, this is essentially, it's called my Eaton approach, EATN. So exercise, lifestyle adjustments, traction therapy, and then nutrition. So putting those together to help to decrease pain, to help improve spinal health, improve stenosis, and improving those symptoms naturally. But we have to be consistent with it. We have to be our own guarantee, or be your own guarantee for your spine. But you always, I shouldn't say always, you might need a little help with that, especially this is not talked about a whole lot, and you might be told to get surgery or drugs, and you don't want to do that. Well, if you need additional help, again, I'll link to the directory of chiropractic biophysics trained doctors in the description. So take a look at that, see if there's anybody in your area. Type in list if you want that Strong Spine food list. And if you need any other additional help, leave comment below and reach out to me. In the meantime, definitely be your own guarantee for your health and your life.